Everyone has been automatically muted and has their camera turned off. So please feel free to utilize the chat box or Q&A if you need something or have questions throughout. We'll have a Q&A session at the end, so any unanswered questions, we'll get to them at the end of the presentation. And if we don't answer your question, we'll be sending out a follow-up email with a recording of this session, and we can answer any questions we didn't get to then. Like I said, you will get a follow-up email that will have a recording, so you can watch this later if you need to, or if you need to hop off, you can rewatch it later at your convenience. And we'll also be sending out a survey after the presentation just to see if you guys have any feedback, what we can do better next time. We'll be doing these webinars monthly, so make sure you tune in for the next one. So with that, let's get started. Today, we're going to explore common misconceptions about heart health, dive into functional medicine, and how we identify those root causes of cardiac disease. We're going to discuss how IV therapy can play a vital role in optimizing cardiovascular health. And hopefully by the end of this, you'll have actionable strategies to help protect your heart and improve your overall health. As I said, I'm Samantha Hart. I am the nurse practitioner over the functional health program at IV Nutrition. We may have previously met at our January webinar just a couple weeks ago. We may work together, or some of you may have had an appointment with me or taken advantage of our free intro call. But for everyone that's new here, just a little bit about me. I officially started with IV Nutrition in November 2024, but I've been learning in the background about the company and about functional health as a client and provider over the last 5 years. My primary role is doing lab reviews and creating custom recommendations utilizing the services that IV Nutrition offers. I'm also working to help provide more education and engagement for our clients and staff. So these monthly webinars are kind of a way to do that. They're open to any current clients, potential clients, and our IV Nutrition team. A little bit about my background. Just prior to starting with IV Nutrition, I did primarily work in the hospital setting. I actually worked in inpatient and outpatient cardiology. But over the last few years, I really focused on expanding my knowledge to include learning more about functional health in the functional healthcare world. I was growing frustrated with some of the limitations of conventional medicine, just different barriers, trying to do alternative options, issues with insurance coverage, and just really limited time to talk to my patients and not really always getting to understand the why behind certain recommendations and treatment plans. I felt strongly that I wanted to be able to support my patients in making informed decisions and help them advocate for themselves. So I wanted to help also teach about preventative options, so people had some education about what they could do before they went down the pathway of being diagnosed with a chronic disease and maybe being stuck on medications long term. I truly love educating the people I help care for and want them to feel comfortable with their health decisions. My biggest draw for functional health continues to be just learning about how amazing our bodies truly are. They're designed to help regulate and balance everything, but often we need a little extra support as we go through life. In case you missed our January webinar, we covered what functional health and medicine are. So I'd like to do just a brief overview on that. So what is functional medicine? The terms functional health and functional medicine often get used interchangeably. I like to think of functional medicine as just going back to the basics. Functional medicine works to make health more patient-centered rather than disease-centered. And functional health is more of a holistic approach that focuses on identifying and addressing the root cause of disease. We look at things from an approach that everything in the body is connected, really focusing on supporting, like I said, addressing root causes and prevention of symptoms and diseases, utilizing vitamins, minerals, and other nutrients your body easily recognizes and can easily use. The overall goal is to really support each person in an individualized way. So I want to start with talking about what does cardiovascular disease even mean? Cardiovascular disease is the term for diseases involving the heart and blood vessels, or veins and arteries, and can include coronary artery disease, or coronary heart disease. This is a disease that affects the blood vessels that supply the heart muscle. Cerebrovascular disease, that's a disease that affects the blood vessels that supply your brain. And peripheral artery disease, a disease that affects blood vessels that supply blood flow to your arms and legs. And really, cardiovascular disease encompasses so much more. Some of the main risk factors for heart disease include smoking, high blood pressure, high cholesterol, unhealthy diet, lack of exercise, obesity, and even air pollution. So why does cardiovascular health matter? Cardiovascular health is so important because it helps your body deliver oxygen and nutrients to your organs and cells. It helps your body meet the demands of exercise, stress, and activity. Heart disease remains the leading cause of death globally, no matter your ethnicity or gender. Here in the US, nearly 1 in 4 deaths is due to cardiovascular disease. Studies suggest that lifestyle changes may help prevent a significant portion of cardiovascular disease. The problem with conventional approaches is their focus is on managing symptoms rather than addressing the underlying causes, like chronic inflammation, oxidative stress, or nutrient deficiencies. Functional medicine takes a completely different approach, which we'll explore in depth today. To understand how to care for your heart, we need a basic understanding of the cardiovascular system. Your heart acts as a pump, pushing oxygen-rich blood through your arteries and into all your tissue. You can remember arteries start with A, and so does away. So arteries move blood away from your heart and into the tissues. Veins carry oxygen-depleted blood back to the heart and lungs to start the cycle again. You can think of your arteries as a highway delivering critical supplies like oxygen and nutrients to every cell. If these highways get clogged or damaged, your cells can't receive those deliveries and therefore can't function properly, which is why maintaining cardiovascular health is so vital. There are really 4 major factors that impact heart health. Diet, consuming processed food, refined sugars, trans fat can all damage arteries and increase inflammation. Many people are also deficient in key nutrients that are important to cardiovascular function, like magnesium and omega-3. Stress. Chronic stress elevates cortisol levels, which raises blood pressure and damages arterial walls over time. Physical inactivity. Your heart is a muscle. It weakens without regular exercise, reducing circulation and efficiency. Environmental toxins. Pollutants and chemicals in food, air, and water create oxidative stress, harming your cells and blood vessels. These are areas we can control, and addressing them forms the foundation of functional medicine. So let's debunk some common myths. For decades, cholesterol has been blamed for heart disease, but here's the truth. It's not cholesterol itself, but the type of cholesterol and how it interacts with your arteries that matters. Cholesterol is a type of lipid. It is a waxy, fat-like substance found in every cell of your body. Although cholesterol is often demonized, the body needs it to make cell membranes, hormones, and vitamin D. Cholesterol comes from 2 sources. It's made by the liver and animal-derived foods. About 80% of cholesterol in your blood comes from your liver and intestines, and only the remaining 20% comes from what you eat. What you eat does provide your liver with the building blocks to make cholesterol. So eating too much saturated and trans fat can contribute to producing high levels of the bad cholesterol. LDL cholesterol is typically what gets labeled as bad. Small, dense LDL particles are the most damaging because they penetrate arterial walls and oxidize, triggering inflammation. Functional medicine looks beyond basic cholesterol numbers and focuses on reducing those small, dense LDL levels and systemic inflammation, which are the true culprits of cardiovascular disease. HDL is known as good cholesterol. It is transported from the cells to the liver, where it can be eliminated from the body. A higher level of HDL is associated with a lower risk of cardiovascular disease. Another common myth is that your genetic predisposition determines whether you'll develop heart disease. While genetics play a role, they are not your destiny. How your environment and lifestyle influence gene expression plays a big role. So you do have some control over these genetics. For example, high homocysteine levels, which is often linked to genetics, can damage blood vessels and increase your risk for cardiovascular disease. Functional medicine identifies and corrects issues like this through targeted nutrition, such as B vitamins, which can help metabolize homocysteine and lower your cardiovascular risk. Some further common misconceptions about cardiovascular health based on conventional practice are statins fix heart health. While statins lower LDL cholesterol, they don't address inflammation, which is often the root cause of cardiovascular disease. Functional medicine focuses on reducing inflammation for true healing. Myth: you can't reverse heart disease. Numerous studies show that lifestyle changes, including diet, exercise, and functional interventions, can reverse arterial damage and improve heart health. Myth: medications are the only option. While medications can be life-saving in certain cases, many conditions improve significantly with nutrition, utilizing IV therapy to replete any nutritional deficiencies, and stress reduction. These strategies work together to restore balance and health naturally. Some risk factors are lifestyle changes that will be up to each individual to make. But through the functional health approach and utilizing the services through IV nutrition, we can help educate and support you through these changes. Some risk factors, like utilization of specific vitamins and antioxidants, are changes IV nutrition can help with and make a direct impact on. Some of the risk factors that we can help with are quitting smoking and decreasing your alcohol intake. These are two modifiable risk factors that can decrease your chance of developing heart disease. One functional approach that may help support your body is kicking these habits utilizing NAD. Now, without getting too far off topic, some basic information about NAD is that it's a coenzyme found in all of our bodies. It is responsible for a number of benefits, such as maintaining energy levels and mental clarity. Boosting your natural levels of NAD can also help overcome addiction, like smoking and excessive alcohol use. IV nutrition offers NAD therapy in IV form and IM injection form in multiple different doses. Obesity can increase your risk of developing cardiovascular disease by contributing to several factors, including higher risk for high blood pressure, high cholesterol, type 2 diabetes, and systemic inflammation. Obesity increases the risk for accumulation of fat around your organs, which puts extra strain on the heart and damages blood vessels. Some factors that play into managing weight are diet and exercise. The American Heart Association describes a heart-healthy diet as a wide variety of fruits and vegetables, whole grains and products made up of mostly whole grains, healthy sources of protein, primarily plant-based proteins such as legumes, nuts, fish, and seafood are also approved, low fat and fat-free dairy, and if you do eat meat and poultry, you want to ensure that it's lean and unprocessed. Liquid, non-tropical vegetable oils such as canola, corn, olive, soybean, and sunflower oils, minimally processed foods, minimized intake of added sugars, and foods prepared with little or no salt. That can kind of sound overwhelming and limiting, so I really try to encourage people to follow what I consider a modified paleo and Mediterranean diet approach, meaning really focusing on eating fruits and vegetables, making sure you're getting enough fiber in your diet, and making sure you're eating enough protein with each meal. Focus on limiting your carb intake and limit eating stuff that comes in a bag, box, or packaging. Try adding in healthy fats like olive oil and avocados rather than vegetable oil or sunflower oil. Increased physical activity can decrease your chance of developing cardiovascular disease. A great place to start is by implementing physical activity 15 to 30 minutes a day that gets your heart rate up around 100 beats per minute or more. This could be as simple as spending 15 or 30 minutes jumping in place, doing jumping jacks, running in place, or even jump rope. There are also emerging studies that weight loss peptides, such as semaglutide and tirzepatide, which are considered GLP-1 receptor antagonists, not only support weight loss, but may even reduce your risk of cardiovascular events. Aging can increase the risk of cardiovascular disease because it causes changes in the heart and blood vessels, like stiffening of blood vessels. These changes can lead to higher risk of heart attacks, heart failure, and other cardiac issues. We can't stop the aging process, but there are many nutrients available that can help support. Functional medicine takes a proactive approach by identifying root causes instead of managing symptoms. Through advanced testing, we uncover hidden issues like systemic inflammation, oxidative stress, and nutrient deficiencies. For example, if someone has fatigue or high blood pressure, we don't just prescribe medication, we look for underlying factors like magnesium deficiency or elevated homocysteine levels. These insights allow us to create personalized care plans, which can include lifestyle changes, nutritional guidance, and even utilizing IV therapy. With functional health, we take a look at how everything is connected. This pyramid is a visual to help represent how all systems are interrelated. Though heart health is towards the top, it is significantly influenced by all the factors further down on the pyramid. It is important to address the factors lower down in order to help address the factors that are higher up. Something that may be surprising is that your thyroid function, cortisol levels, and hormones can all play a major role in your risk for developing cardiovascular disease. The gut-heart axis is an emerging concept that there is a crucial link between your gut and your risk for cardiovascular disease. There is a complex interaction between the heart and the GI tract. Dysbiosis, an imbalance in your gut biome, may contribute to cholesterol imbalances and atherosclerosis by influencing systemic inflammation, intestinal barrier function, and nervous system function, hormonal balances, and your immune system. IV therapy and IM injections deliver vitamins and nutrients directly into your bloodstream, bypassing the digestive system. This ensures maximum absorption. Utilizing these services can help correct nutrient deficiencies. Specific vitamins and nutrients are thought to help reduce inflammation, improve vascular health, and help support long-term cardiovascular function. Let's take a look into the key nutrients that can be provided through IV therapy and why they are so powerful for cardiovascular health. First one is magnesium. This mineral relaxes blood vessels, helping to reduce blood pressure and improve circulation. Magnesium deficiency is common and often contributes to cardiovascular issues. Many of our IVs at IV Nutrition contain magnesium in varying strengths. Next nutrient is CoQ10. This antioxidant is critical for energy production in the heart, which is the most energy-demanding organ in the body. CoQ10 is often depleted by medications like statins. CoQ10 can be taken via oral supplement, but IV Nutrition also offers it in an injection form for increased benefit. Vitamin C. Beyond its immune-boosting properties, vitamin C reduces oxidative stress, protecting the delicate lining of your blood vessels. Many of our IVs at IV Nutrition contain vitamin C at varying strengths. Glutathione, known as the body's master antioxidant. It detoxifies harmful substances and combats inflammation. IV Nutrition offers glutathione through the IV route or intramuscular injection via deep detox, double detox, glutathione detox injection, and our Magic Mojo injection. B vitamins, particularly B6, B12, and folate. These vitamins metabolize homocysteine, lowering levels that can damage blood vessels and increase cardiovascular risk. L-carnitine may help lower blood pressure. It is involved in the metabolism of lipids and may improve blood pressure by reducing insulin resistance. It can improve insulin sensitivity and may help improve blood flow by improving tone and dilation of vessels. Vitamin D deficiency has been associated with the increased risk of high blood pressure, heart disease, stroke, and other cardiovascular events. Some of our heart supportive IV services we offer are our Mini and Mega Myers, containing vitamin C, magnesium, and B vitamins, Balanced Brain, which contains vitamin C, magnesium, and B vitamins, Absolute Athlete, which contains L-carnitine, magnesium, vitamin C, and B vitamins, Belly Blaster, which also has L-carnitine, magnesium, vitamin C, and B vitamins. We also have Mega Magnesium, which is magnesium, and Colossal C, which has a significant amount of vitamin C in it. Some of our heart supportive intramuscular injections that we offer are B Blast, which contains B vitamins, Catalytic CoQ10, Simply Sunshine, which has vitamin D, and Belly Buster, which contains L-carnitine and B12. Functional testing is essential for understanding the full picture of your cardiovascular health. Here are some of the key markers we look at. Small, dense LDL particles are far more dangerous than traditional LDL because they're more likely to oxidize and trigger inflammation. Homocysteine, high levels damage arterial walls and promote clotting, increasing cardiovascular risk. B vitamins play a role in homocysteine metabolism, which is a factor in cardiovascular health. CRP, or C-reactive protein. This marker shows the level of systemic inflammation in your body, which is a major driver of heart disease. Triglycerides and HDL ratio. This ratio is more predictive of heart disease than total cholesterol, giving us a clearer picture of metabolic health. These tests allow us to create a personalized care plan tailored to your unique needs, targeting the underlying causes of any imbalances. So let's go over your Heart Healthy Action Plan. Here are actionable steps you can take to improve your heart health starting today. Nutrition. Eat whole, unprocessed foods like leafy greens, salmon, and antioxidant-rich berries. Try to avoid refined sugars and trans fats. Exercise. Move your body daily. Cardio strengthens your heart, while strength training and flexibility exercise improve circulation and reduce stress. Stress management. Incorporate mindfulness. You can incorporate practices like yoga or meditation and identify ways to minimize stress in your daily life. Professional care. Schedule a comprehensive blood work review and consider incorporating IV therapy into your routine to address deficiencies and inflammation. If you're interested in learning more about functional health, we will be hosting a webinar each month this year. We'll be working our way through each body system, with the next topic being a focus on GI health. So be watching for information on how to register for that. If you liked this webinar, please feel free to share future registration information with friends and family. If you're interested in learning more about how IV nutrition can help you with your health goals and preventative care, please feel free to use this link to schedule a free call with me. I would love to help you find the clinic closest to you, discuss next steps, and get you on the right track. We'll make sure to share that link in a follow-up email. I have also included my link tree. This includes links so you can follow my social media accounts and continue to receive updates and future education. We will share that in the follow-up email as well, or you can scan the QR code on the screen with your camera on your phone and it will take you there. I would also like to invite each of you to visit ivnutrition.com after the webinar to check out the services we offer and take a look at all of our current locations. All right. Thank you so much for attending. We will now be answering some questions. We will try to answer as many as we can. If your question is not answered, please watch for a follow-up email. This will also include the recording of the webinar and a post-presentation survey. All right, let's switch to our Q&A and see what questions we have so far. Question number 1, says you mentioned functional medicine focuses on root causes rather than symptoms. What are some of the most common overlooked root causes of cardiovascular disease? I think we kind of touched on that. I think a big part is we don't necessarily, in the conventional kind of standpoint, the role of inflammation in cardiovascular disease. So many different things can cause inflammation, whether that's stress, that can be physical stress, emotional stress, things that we're exposed to in our environment, whether that's things we're eating that are causing irritation, toxins that we're exposed to, viruses that aren't like fully eradicated can cause chronic inflammation. The list kind of goes on what causes that root cause of inflammation. So I think just focusing on looking at that as a possible root cause, rather than just saying you have heart disease and here's some medication to kind of stop that heart disease from getting worse. We don't really necessarily talk about what we can do to undo that heart disease. Like I said, kind of getting back to that root cause. Also, nutrient deficiencies, like we talked about, magnesium. That's a level that really doesn't get checked in the conventional world unless we have a specific reason to check it. So I think, checking that and just making sure that your magnesium truly is being optimized. It's a really, really great supplement that you can take daily and also through the IV route. Let's see, next question. So how do you determine whether someone's cardiovascular issues are due to inflammation, nutrient deficiencies, or other factors? So really starting with gathering the person's history. So going over anything they've been diagnosed with so far, any medications they're on currently, and really just going kind of back to their lifestyle, what they've done kind of up to this point. A really easy way to take any question out of there is doing lab work. Lab work doesn't lie. It gives us a really specific, this is what's going on inside your body. And I can use that information to come up with a plan for you and, know what your specific risk factors are. Let's see if there's any. How does functional medicine address heart disease differently for like a younger person or older person? So I think really, there's a little bit more aggressive approach options versus maybe just focusing on what we can do to prevent disease. Typically, someone that's younger probably doesn't already have cardiovascular disease, but we can look at their labs or, based on some symptoms and maybe get an idea, are they trending that direction? Do they have a family history of it? That the genetic factor there, is there things that we need to just do to keep them on the right track? Or is there things we need to do to kind of get them off the pathway of developing heart disease? Whereas someone older, maybe a little bit increased risk. Definitely over time, we build up more inflammation, kind of run a higher risk for different nutrient deficiencies. And really, after 30, unfortunately, our body does a worse job of regulating cholesterol on its own and regulating hormones on its own. And so definitely just really making sure all of those pieces are where they need to be and optimized in an older person, just to prevent them going down that road of developing cardiovascular disease. Whereas if they, come to me and they already have had that diagnosis, really want to do a much more aggressive approach, you know, weekly vitamin C, um, with, IV therapy, that's going to be a lot more aggressive approach. I have a few more questions here. Um, for someone with high blood pressure, what role can IV therapy play in managing their condition? So if you've been diagnosed with high blood pressure and you are on blood pressure medication, um, from the functional health role, we're never going to say stop your prescription medications. Always going to keep you on what you're on, but we would love to help support some of the side effects some of those medications can cause. Um, and maybe we make improvements and you can wean off of it. A big part of is, why are you having that high blood pressure? Is it, like we talked about, inflammation in the arteries that are causing narrowing? Is there strain on your heart? What is it that's causing you to have that high blood pressure? You can also utilize IV magnesium. It can be really beneficial with dilation of the vessels, which can help lower blood pressure. Something I like to point out with how conventional blood pressure medication works, all of them work in some way that they either block or um, inhibit or kind of increase your body's ability to control um, your blood pressure. So whereas you might normally get a trigger from your adrenal system or nervous system in some way, instead of getting that trigger from your natural system, whatever the medication you're on, there's beta blockers, there's ACE inhibitors, calcium channel blockers, all of those function in a way to change your body's natural signaling. Um, so I just like to point that out because a lot of people don't really think about how their blood pressure medication works. But it's changing what your body's natural reaction is, whatever it is that's telling your blood pressure to go up, go down. Those blood pressure medications inhibit that. Let's see. If someone's already taking some of the supplements you talked about, like magnesium or CoQ10, how does IV therapy add additional benefits? So that kind of goes back to talking about, why IV therapy. We touched about this a little bit in the January webinar, but when we do supplements, nutrients through the IV route or even the IM injection route, we're bypassing that gut. So we're really just flooding your system with whatever the nutrient is and kind of forcing it, into the cellular level. When you take it orally, you can only absorb a certain amount and your body kind of cuts off that limit. Um, so like I said, when we do it the IV route, we're flooding your system, whether you have that gut health issue that prevents how much you're able to absorb or not. We really just bypass that. Um, so even if you are taking oral supplements, really switching or adding IV route can kind of take that to the next level. So if you're deficient in magnesium, still taking an oral supplement daily, when we switch to that IV route where you can really just maximize how much magnesium you're getting. I also like to point out, talking about oral supplements, not all are created equal. So if you're just taking CoQ10 that you got at your local drugstore or grocery store, or taking magnesium that you just got online, um, not always you can't always promise that that is like a high quality um, supplement. Supplements are kind of a gray area on being regulated by FDA, and so sometimes they can make claims about what's in them or how they're absorbed. So just really, really making sure that even if you are taking those supplements already, that you're on good, high quality ones. Yeah. What's the biggest misconception people have about IV therapy for heart health? So I think a big misconception, just in general for IV therapy is that it's only you can only use it when you're sick or, you know, only use it when you have an issue. And I think that's really back to that conventional healthcare thinking. IV therapy is amazing for preventative. It works really great when we're talking about preventative care. Um, maybe you're in that absence of disease or you feel healthy, everything's going pretty good. And if you were to just kind of add IV therapy to the mix, you would really optimize your health, and get really big benefits from adding a preventative approach. Um, so I mean, heart health specifically, I think, people don't think about nutrients playing such a big role, um, in how your heart functions and your cardiovascular system functions. So I don't know if there's even a misconception because I doubt people even think about how they can utilize, vitamins and nutrients to help support their heart health. Let's see. Lots of questions. Um, you mentioned the gut heart connection. Are there specific IV nutrients that help bridge the gap between gut and heart health? So I would say just really focusing on inflammation. So sometimes, we're talking about focusing on heart health, but when we kind of work our way backwards, looking at root causes, may need to focus more on, addressing gut inflammation specifically. Um, we often worry about like systemic inflammation, but sometimes that roots back to the gut as well. So occasionally it involves further testing to really narrow in on where that inflammation is coming from. If it is the gut, a lot of times we utilize a test called the GI map. Um, Literally, you send in a stool sample and they send back a report um, about, what makes up your gut biome. That's definitely a test we'll talk a lot more in depth about at our next webinar. Um, but you can have different things kind of thrown off in your gut biome that cause inflammation, um, or can impair your ability to absorb certain things like oral supplements. Um, so really, focusing on inflammation, um, specific services that would be good for that. I really like Repair and Rebuild. Um, that has the vitamin C. Um, Really, anything the more the more vitamin C, that's going to be really the services we point you towards when we're worried about inflammation. Also, we talked a little bit about glutathione, a really great add-on when we're worried about inflammation and kind of that detox. Let's see. Got another question about if IV therapy can be used as a preventative measure. Is it mostly for people with existing heart issues? So we kind of touched on that. Yeah, definitely amazing for preventative measure, but also an option for uh, people with heart issues. Now, I will say we do have some contraindications. If you're somebody that has heart failure, if you've ever been told like you have congestive heart failure, you would not be a good candidate for IV therapy because we don't want to give you extra fluid. Um, but that doesn't mean that you are not a candidate for some of our injections, our IM injections. Still a lot of the same nutrients, but minus that fluid aspect. So just because you have heart disease or been diagnosed with heart disease, been told you have heart failure, or follow with a cardiologist, it doesn't mean you are excluded completely from utilizing IV, the services of IV nutrition. Um, see. That kind of answer. I got another question if there's any conditions where IV therapy should be avoided or modified. So that would be probably the main one. If you have heart failure, um, definitely don't want to add extra fluid. Um, how long does it typically take for someone to feel the benefits of utilizing IV therapy? Um, Kind of a broad question. Just really depends on, what we're focusing on, what we're using it, how often you're doing it. If it's just for preventative, you may not necessarily obviously notice a significant um, change, but if you are using it for a specific complaint and you're going weekly and really just kind of doing more of an aggressive approach, um, I usually say about kind of 3 months of consistency, you start noticing some changes and improvement. Um, I would say that's for like if you have a really acute concern. If it's more of a long-term chronic thing that's been going on, it can take a little bit longer. But really, consistency is key. Um, really sticking with a plan, and you can't have like an acute issue and just go once a month and be like, well, I should feel better. What's going on? It really is. It is a consistent thing, especially up front. Um, and then once things are improving, then we kind of cut down to that once a month or twice a month approach. Just really depending on, what your specific issue or goal or, um, you know, how often we're doing it. Let's see. Okay. I think that is all of our questions. So, just want to remind everybody again, you'll get a follow-up email that has a recording of the webinar, so you can share that or rewatch it. Or if you had to hop off early, you can rewatch the recording. Um, but we really would love to see you at our next webinar in March, and we'll be talking about gut health. So be watching for information on how to register for that. We'll have the link in that follow-up email. Um, we'll also be sending out a survey with that follow-up email, so you can let us know if there's anything you like, didn't like, or anything we can do better, or information that you wish we could include. I'd love to help make these, whatever it is you guys need and what you're looking for. I use them to help educate clients, but I also use it to help educate our staff. So they're hearing the same information you guys are hearing, so they can really help, um, you know, educate you guys and help point you in the right direction about what services at IV Nutrition are going to help support what goals you're looking for. I just want to thank you, everyone, for spending your afternoon with me and learning about cardiovascular health. And I hope you got some takeaways, and look forward to talking more to you guys and see you next month. Thank you.